Good morning, everyone. I'd like to welcome you back to this morning's session. We're going to be talking briefly about the role of artificial intelligence in spine imaging. We've all heard about applications of artificial intelligence to medical questions, but there's nothing more challenging than actually putting these technologies and new techniques to the real-world test. So we'll talk briefly about my experience with the project evaluating the role of artificial intelligence, evaluating neuroforaminal stenosis and central spinal canal stenosis in a normal population. I have no disclosures as in this lecture as well as the others. I'd like to acknowledge the contributions of all of the collaborators. The study was actually PI'd by Dr. Luke McKeisen, who's one of the neurosurgeons at our institution, with significant input from a bevy of very talented PhDs. So the clinical problem is as follows. The spinal canal and neuroforamina allow for the passage of nerve roots through and out of the spinal canal, obviously. Degenerative narrowing of these passages is very common, and canal stenosis can result in severe compression and possible neurogenic claudication when it involves a central spinal canal. In addition, foraminal stenosis can result in a nerve compression of the exiting nerve and lead to radiculopathy and possible nerve injury, sometimes irreversible. These syndromes, either neurogenic claudication or radiculopathy, are a major cause of morbidity and disability in this country and worldwide. And over 500,000 people are affected annually in the United States, either with signs and symptoms of neurogenic claudication or of lumbosacral radiculopathy. Now, the clinical challenge is that the practice of grading spinal canal and foraminal stenosis has been shown to be highly subjective with significant inter-rater variability. And in a study published by Brady in 2012, he was just one of many who said that, look, there's really a lot of discrepancy and variability in the way that radiologists interpret these scans, and unless you have a very tight relationship with your orthopedic or neurosurgeon, it may be difficult for them to understand your language and what mild, moderate, and severe means to you versus what it means to them. So accurate grading of stenosis severity is important because the degree of stenosis is a primary consideration in clinical and surgical therapeutic decision-making. However, there are currently no widely accepted standardized quantitative definitions of spinal canal or foraminal size, remarkably.